curative care and well-being. So this is in tune with the recommendations of the Economic Survey 2020-2021, which called for improving the health infrastructure. By recognizing health and well-being as one of the 6 target pillars, for this fiscal year, the Prime Minister and Finance Minister has demonstrated the focus on building a more resilient healthcare system. In an unprecedented move, rupees 2.23 lakh crores has been allocated towards health sector in the Union Budget 2021-22, as compared to the budgetary estimate of rupees 94,000 crore during the last year. So this is almost an increase of 137% and the highest allocation so far since independence. I congratulate the Finance Minister and the Health Minister for giving a special focus on the healthcare system. Sir, India's public health expenditure has increased from 0.9% of GDP in 2015-16 to 1.1% of GDP in 2021. The National Health Policy 2017 aims at increasing the public health expenditure to 2.5% of GDP by the year 2025. So the Ministry of Health and Family Welfare broadly has 2 departments. One is Department of Health and Family Welfare, which implements the health schemes and regulates medical education and training, and the Department of Health Research, which is broadly responsible for conducting medical research. In the Department of Health and Family Welfare, 96% of ministry's allocation has been given, that is rupees 71,000 crores, and 4% allocation has been given for health research, that is rupees 2,663 crores. Sir, as we all are aware that last entire year has been a COVID pandemic year, and that is why the government's focus has also been on improving the COVID-19 vaccination in the country, and that is why the government has given rupees 35,000 crore for the vaccination program, and the Honorable Finance Minister has also promised if any additional funds are required, that will be given. Sir, I was hearing to many of my friends from the opposition who were speaking on what government has done during last 1 year during the COVID-19 pandemic. I would like to draw the attention of this August House towards the actions taken towards COVID-19 pandemic management. So the first case of COVID-19 in India was found on 30th January 2020. But our health minister had very early, that is on 8th January 2020, made a joint monitoring group that was a technical group under DGHS, and the first meeting was held on the 8th of January. Now, sir, health being a state subject also, and India is a federal political structure. So while taking any decision, all the state governments were also taken together, and in collaboration with the state governments, all stakeholders and the different community organizations were all brought on one platform to fight against the COVID-19 so as to minimize the impact of the disease. So surveillance was started at the points of entry. People from different parts of the world who were coming to India, the proper surveillance started for airports, seaports and land ports. Also surveillance within the community was started by Integrated Disease Surveillance Network. So travel advisories were also issued, and continuous update of the travel advisories was also done. Active screening and isolation of the travelers was started on 18th January, that is almost 12 days before the first case of COVID-19 was reported. Partial lockdown was announced on the 22nd of March, and complete lockdown was imposed on 55th day, that is 25th March. Sir, I was listening to our friends from the opposition, and they were asking that why complete lockdown? Sir, अगर हमारे देश में कंप्लीट लॉकडाउन अगर नहीं होता तो हम कल्पना भी नहीं कर सकते कि कितने सारे लोग कोविड-19 से इन्फेक्ट हो सकते थे। आज हमारे देश में सही समय पे लॉकडाउन लागू करने के कारण हम लाखों लोगों की जानें बचा सके। सर, कोविड-19 के मैनेजमेंट में प्रमुख रूप से टेस्टिंग, ट्रीटिंग एंड ट्रैकिंग इस फॉर्मूला से काम शुरू किया गया। कोविड-19 ये एक वैश्विक महामारी से पूरी दुनिया जब पीड़ित थी, और ख़ास तौर पे सर हम लोग जब वेस्टर्न कंट्रीज़ की बात करते हैं, जिन्हें हम डेवलप्ड कंट्रीज़ मानते हैं, जहां सारा हेल्थ इंफ्रास्ट्रक्चर उपलब्ध है, उन कंट्रीज़ को भी अपने लोगों को वो इस वैश्विक महामारी से बचा नहीं पाए, और हम जो आंकड़े देखते हैं कि जो डेवलप कंट्रीज़ है वहाँ पे सबसे ज़्यादा मॉर्टेलिटी उन देशों में हुई है। एक तरफ हमारा भारत देश जहाँ 130 करोड़ आबादी है और हमारे यहाँ उतना हेल्थ इंफ्रास्ट्रक्चर उपलब्ध नहीं था, लेकिन ऐसे में हमारे देश के यशस्वी प्रधानमंत्री जी ने लॉकडाउन के समय एक संपूर्ण डेडिकेटेड कोविड-19 क्लिनिकल मैनेजमेंट फ्रेमवर्क तैयार किया, जिसमें हज़ारों कोविड केयर सेंटर्स, कोविड हेल्थ सेंटर्स एंड कोविड डेडिकेटेड हॉस्पिटल्स, जिसमें प्रमुख रूप से फोकस था आइसोलेशन बेड्स पे, ऑक्सीजन सपोर्टेड बेड्स से, आईसीयू विथ वेंटिलेटरी सपोर्ट, इन सभी पे स्पेशल फोकस दिया गया। और हमारे देश में क्योंकि इंफ्रास्ट्रक्चर लिमिटेड होने के कारण कई जगह टेम्परेरी हॉस्पिटल्स बनाए गए जो कि डेडिकेटेड कोविड-19 मैनेजमेंट सेंटर्स की तरह काम कर रहे थे। आइसोलेशन बेड्स की संख्या बढ़ाकर 1.5 मिलियन की गई और 0.25 मिलियन ऑक्सीजन सपोर्टेड बेड्स, 80,000 आईसीयूज एंड 40,000 वेंटिलेटर्स की व्यवस्था की गई। हम सभी यह जानते हैं कि वेंटिलेटर्स, पीपीई किट्स, N95 मास्क ये हमारे देश में नहीं बनते थे, हम सारे इंपोर्ट करते थे। तो हम कोविड की इस चुनौतीपूर्ण समय में हमारे देश में पीपीई किट्स का निर्माण शुरू हुआ, टेस्टिंग किट्स का निर्माण शुरू हुआ, वेंटिलेटर्स, N95 मास्क इत्यादि यह सभी वस्तुओं का निर्माण ये लॉकडाउन के समय हमारे देश में शुरू हुआ। और हम संपूर्ण अगर लॉकडाउन का पीरियड अगर हम देखें तो ऐसा हमें कहीं भी महसूस नहीं हुआ कि कहीं पीपीई किट्स कम पड़े या कहीं N95 मास्क नहीं मिले। सभी जो डिमांड और सप्लाई का गैप था वो पूरी तरह से पूर्ण करने का काम ये सरकार ने किया। सर, जनवरी 2020 में अगर हम देखें तो देश में केवल एक टेस्टिंग लैब थी। आज हमारे देश में 2410 लैब्स की निर्मित इस पिछले पूरे एक साल में की गई है। और इसका कारण यह था कि अर्ली अगर आइडेंटिफिकेशन होता है केसेस का तो सही समय पे उनका ट्रीटमेंट हो सकता है। हमारे प्रधानमंत्री जी ये जानते हैं कि लो टेस्टिंग विल लीड टू अंडर रिपोर्टिंग, और इसीलिए भारत में 225 मिलियन कोविड-19 टेस्टिंग्स किए गए, जो आज दुनिया का सेकेंड हाईएस्ट टेस्टिंग का नंबर है। सर, रिस्पॉन्स स्ट्रैटेजी का एक महत्वपूर्ण भाग यह भी था कि हमें रैपिड अपस्किलिंग और कैपेसिटी बिल्डिंग ऑफ हेल्थ केयर एंड फ्रंटलाइन वर्कर्स करना पड़ा, क्योंकि कोविड-19 पैंडेमिक ये पहली बार हमारा पूरा देश फेस कर रहा था और इसमें हमें हमारे जो फ्रंटलाइन वर्कर्स हैं इनको प्रॉपर ट्रेनिंग देना, इनको स्किलिंग करना ये भी बहुत ज़रूरी था। तो यह काम भी हमारी सरकार ने किया। ऑनलाइन ट्रेनिंग पोर्टल शुरू किया। इस ऑनलाइन ट्रेनिंग पोर्टल पे जो हेल्थ केयर वर्कर्स थे इनका भी ट्रेनिंग हुआ, फ्रंटलाइन वर्कर्स का भी ट्रेनिंग हुआ, और उसी के साथ साथ कम्युनिटी बेस्ड ऑर्गेनाइजेशंस, वॉलंटियर्स का भी ट्रेनिंग करवाया गया। इसके कारण 16 मिलियन स्ट्रॉन्ग आर्मी ऑफ कोविड वॉरियर्स हम हमारे देश में बना सके। सर, ANM, आशा वर्कर, आंगनवाड़ी वर्कर्स की भी मदद से प्रचार प्रसार का काम किया गया, सर्वे का काम किया गया। प्रिंट मीडिया, इलेक्ट्रॉनिक मीडिया, सोशल मीडिया के माध्यम से लोगों को जो अफवाहें कोविड-19 के समय में हमने सबने एक देखा कि बहुत सारी अफवाहें इस बीमारी के बारे में स्प्रेड हो रही थी, तो सही जानकारी देने का काम ये भी सोशल मीडिया, प्रिंट और इलेक्ट्रॉनिक मीडिया के माध्यम से सरकार ने किया। सर, एक आरोग्य सेतु ऐप लाकर हमारे देश में एक्टिव सर्विलेंस और कॉन्टैक्ट ट्रेसिंग की भी एक बहुत बड़ी मदद ये आरोग्य सेतु ऐप के कारण हुई, और इसके कारण जो इवॉल्विंग हॉटस्पॉट्स थे उसका सरकार को सही समय पे जानकारी मिलती गई और सही तरीके से वो सारा इवॉल्विंग हॉटस्पॉट को मैनेज किया गया। सर, वैक्सीन रिसर्च का काम भी शुरू था। यह जब कोविड-19 लॉकडाउन चल रहा था तो दूसरे साइड वैक्सीन रिसर्च का काम भी हमारे देश में अलग अलग संस्थाओं में शुरू था, और इसका फल यह मिला कि आज हमारे देश में 2 वैक्सीन्स तैयार हो चुकी है, एक कोविशील्ड और दूसरी है कोवैक्सीन। सर, वैक्सीनेशन ड्राइव की बात करते हुए मैं ये बोलना चाहूँगी दैट कोविड वैक्सीनेशन ड्राइव इज़ द वर्ल्ड्स लार्जेस्ट वैक्सीनेशन ड्राइव सो फार विच हैज़ बीन लॉन्च्ड बाय आवर ऑनरेबल प्राइम मिनिस्टर ऑन 16th January 2021. Government of India established a national expert group on vaccine administration for COVID-19 to provide guidance on all aspects of COVID-19 vaccination, including prioritization of population, procurement, inventory management, vaccine selection, vaccine delivery, tracking mechanism, etc. 2 vaccines made in India. One is Covishield, which is manufactured by Serum Institute of India, and second is Covaxin, which is manufactured by Biotech Bharat International Limited. This vaccine, which is prepared by Bharat Biotech, is researched and developed in India under the Atmanirbhar Bharat scheme. Sir, in addition to these two vaccines, so many people who are speaking here were talking of what if the vaccine will get exhausted. Sir, I would like to draw the attention of the entire House to the fact that in addition to these two vaccines, 7 other vaccines are in clinical trial and 12 additional vaccines are in preclinical trial stage of development. The group that was formed for prioritizing certain population groups for vaccination was based on extensive review to maximize the COVID-19 vaccination drive impact. Prioritization has been done on humanitarian principle of giving the vaccine to those who need it first. So the first priority group includes all the healthcare workers, second group includes the frontline workers, and third group includes people who are above age of 60 or those who are between the age of 45 to 59 who have 20 identified comorbidities. Sir, COVID-19 vaccination utilizes the existing infrastructure of the universal immunization program including the cold chain system. Capacity building of an entire human resource has been conducted in a cascade manner. So when vaccination program had to be started, people who are vaccinators or the team of the people in the vaccination group also had to be trained. So that training part is also being done. Sir, so far 2.64 lakh vaccinators and 4.76 lakh other vaccination team members are trained. A unique digital platform called CoWIN 2.0 has been developed to facilitate vaccination drive. It helps in registration and tracing of every beneficiary along with real-time information on storage of available stock of vaccine, their storage temperature, etc. Sir, as on 11th March 2021, a total of 2.57 crore doses have been administered to 2.10 crore beneficiaries, of which around 47 lakh beneficiaries have completed both the doses scheduled. Sir, after facing the COVID-19 pandemic, the government has taken a very long-sighted decision of increasing the investment in public health and health reforms to prepare India for current and further pandemics. In future, if there is any pandemic, we should be prepared. And keeping that in mind, this budget has majorly given focused on two different parts. One is short term, that is on COVID management, and second is long term, so as to prevent further any such pandemics in the country. The COVID-19 pandemic has brought forth the public health challenges and related needs to strengthen health system to make it more resilient and responsive to emergent health situations. Sir, the Union Finance Minister announced the launch of a new centrally sponsored scheme, the Pradhan Mantri Atmanirbhar Swasthya Bharat Yojana, with an outlay of rupees 64,180 crore over 6 years. This scheme aims to strengthen the health infrastructure by seeking to improve primary, secondary and tertiary health care centers along with existing and future national institutions working in the sphere of detection and cure of new and emerging diseases. This will be in addition to the National Health Mission. The main interventions under this scheme is support for 17,788 rural and 11,024 urban health and wellness centers, setting up of integrated public health labs in all districts, establishing critical care hospital blocks in 602 districts and 12 central institutions, strengthening of the National Center for Disease Control, its 5 regional branches and 20 metropolitan health surveillance units, operationalization of 17 new public health units and strengthening of 33 existing public health units at point of entry, setting up of 15 health emergency operation centers and 2 mobile hospitals, and setting up of National Institution for One Health. Sir, just 2-3 points, sir.
Quick.
A regional research platform for WHO Southeast Asia region, 9 biosafety level 3 laboratories and 4 regional national institutes of virology. Sir, Pradhan Mantri Jan Arogya Yojana, which is meant for improving access to hospitalization services at secondary and tertiary levels, is also focused and given increased budget under this year's budget allocation. Sir, along with this, a special focus has been on the Mission Poshan 2.0. Sir, when on one side we are fighting COVID-19 pandemic, along with that we are also battling the issue of malnutrition, undernutrition. A special focus has been given on this also by merging the supplementary nutrition program and the Poshan Abhiyan together is now Mission Poshan 2.0. And a total budget allocated is rupees 20,105 crore. The allocation for the social services sector, which includes nutrition and social security and welfare, has increased from rupees 2,411 crore to rupees 3,575 crore. Sir, while focusing on nutrition, also drinking water and sanitation is important, because there are many diseases which cause due to unhealthy environment, impure water. Most of the child deaths happen because of diarrheal diseases, and that is why, sir, the government has given around 60,000 crores for drinking water and sanitation program. Sir, while talking of increasing human resource, I would like to thank Honorable Minister for setting up a new medical college in my constituency, Nandurbar, which is an aspirational and a tribal district. And with these words, I support the budget and I thank the Honorable Health Minister. Thank you.
5 बजे माननीय मंत्री जी का